One of my goals is to widely promote core Ayurveda, and that is why I do as much as possible to share this knowledge and also my experiences as a practitioner. But you see, there are a lot of fields related to health and Ayurveda which I'm not that familiar or knowledgeable about when compared to my colleagues, friends, uh, practitioners, and also family members. Therefore, as a part of World as Doshas, I am talking to some super experts in the field of Ayurveda and allied sciences, learn from them and share this information online for all of us to learn. Okay, hope you enjoy these as much as I've enjoyed these insightful conversations. Today I'm excited talking to Dr. Manoj, a very dear friend and a practitioner of Marma Ayurveda. So Marma Ayurveda, this field is something which not too many people are experts in, and Manoj is an expert, plus he is also from the family of lineage. Okay? He's got a huge family history of Vaidyas who have been traditionally practicing Marma Ayurveda. Dr. Manoj, okay, he runs a wonderful Marma hospital called Marmmayogi. It's on the banks of the Thodupuzha river, a beautiful place. Okay, so a lot of patients in different parts of the world, they come to him and get treatment for injuries, chronic illness, and other health related issues. So this is a place where a lot of Marma treatments happen. Here is part 2 of our conversation. Yeah, and if you look at Ramayana, okay, when they say about just you told about Ravana, Ravana was picking Sita and flying away. So that's when Jatayu comes and they have a fight. And at that time they discuss about Marma, and Ravana asks Jatayu where your Marma point is. So he says that it is in my wings. And Ravana says it is in my in my umbilicus or toe or somewhere, umbilicus if I'm right.
Umbilicus.
So Jatayu, so Jatayu says, okay, then Jatayu understands that to kill Ravana, he has to go to the umbilicus. So when Jatayu is going towards his Marma, Ravana actually chops off Jatayu's wings because that is his Marma. So then Marma discussion happens in those days also. It has happened, And, one thing, Manoj, I would want to ask you is, if you look at movies sometimes, there's a movie called Indian. I don't know whether you have seen the movie, Kamal Hassan's movie. Okay.
What is it? I didn't hear that.
Indian.
Okay.
Yeah. Where, they show, he touches a person and the person just falls,
Yeah.
So, are these things actually possible if you become an expert in Marma?
Nambi, I think it is possible because we are never trained in Abhyasa Marma. There are two types of Marma. That is, one is called Abhyasa Marma, that is for hitting a person during the martial art. What we have trained is in Chikitsa Marma, in which also there are so many points mentioned like Sadhya Pranahara and all. But we never used it, for creating an injury for the person. So we have learned traditionally to, if there is an injury happened, how to make him up or bringing him out of the injury. So I think it is possible because the points like Sadhya Pranahara in Tamil tradition or South Indian tradition, they are called Padumarmas. So the Padumarmas are the point where there is an injury, or if it is happened exactly in the Marma points, the person will die immediately. If there is injury happening in somewhere around that, the person may fell unconscious or like that. So it is possible. So, I have never came across some incidences like that.
But see, according to Ayurveda, there are classified as Sadhya Pranahara, that means immediate death. Kalantara Pranahara, that means if you get injured, you die after a point of time. Then Vaikalyakara, that means you become handicapped. then Rujakara, where you can inflict a lot of pain, and Vishalagna. Vishalagna is also a very, very important thing, and the things. If you are hit by something, correct me if I'm wrong, Manoj. If you hit with something, you are okay as long as it is there. The moment you remove that shalya, remove that thing that has hit you, the weapon, or it can be an arrow, it can be any external object. You remove that, you will die. It is like if you have noticed, yeah. So there is one. See, if you look at, for example, if you look at the ex Chief Minister of Tamil Nadu, what you call M.G. Ramachandran,
Yeah.
he was shot, and there is he was shot, and a bullet was there in his in his throat. And we hear that the doctor was saying that because it was too close, it was inside a place, that if you remove it, he will lose his voice completely, or something might happen. So they left the bullet like that. So that is also something like, the shalya is left there without disturbing, right?
Correct.
Yeah. So Manoj, why, in your opinion, is Marma so unique? Like when we have certain things like, now we have got acupuncture, we have got acupressure, etc. All those things. How do you consider Marma to be different from this thing? Or how do you compare these two? How do you say these are similar? Or how can you say these are different?
As I told you, Namit, there are so many vital energy points in our body, not only the 108 as we have studied. It's all connected to the chakras, nadis, and marmas. As you know that there are 7 major chakras, which takes the energy from, or prana, from the nature. So there are 3 ways, as we know, the prana can be taken to our body. One, through the breath. Okay, when you take it through the nose, when you breathe, the prana goes in. One, through the food you eat. Okay, another through the chakras, from the nature, from the universe. Okay, so as we know, the chakras are something like a spinning wheel or a whirlpool. When it spins, it sucks the energy and it distributes to the body through the nadis. Okay, so there are so many nadis. It is identified by the great saints that about 72,000 such nadis are there, as per the yogic tradition. So when this prana moves through these nadis, at some points, as we said, where it intercepts or all, the prana stays more pulsating or more throbbing like. So there are thousands of marma points in our body. In Ayurveda, we have identified 108 marmas and being used. The Kalari martial art people have identified certain other, not only this, some other points also they have identified. So in Chinese system, or acupuncture or acupressure, I think it's developed in China. As we know that there are some stories that a South Indian king from, I think, Mahabalipuram, a Pallava king, went to China and he developed the martial art, Shaolin school. Bodhisattva. Correct. And so he developed the martial art school, and there they have developed this system. So there is some connection.
That's a Shaolin temple,
Yeah, that's true. So they have gone lot of more details, and they have developed it in a very, specific or very, detailed way. And that the important thing is they are being practicing it. So that is what makes it different. So they have developed in China. That is what I understood. Along with the medical science, whether it is Chinese traditional system, they call it traditional Chinese medicine, TCS or something like that, or with modern medicine, TCM. Okay, something like that. They are combining all this and they are learning as a whole. That's a problem in India, that Ayurveda is different, modern medicine is different, Homeo is different. See, this is something which we have to understand, that whatever system you apply, the patient has to be benefited.
True.
Okay. And I think in China, that's what my understanding, I don't know whether it is correct, the patient can choose, the doctor will ask you what type of medicine you prefer, or type of system of treatment you prefer, whether it is modern medicine or traditional Chinese medicine, or, what some other medicine. They are ready to give them the way the patient prefer. I heard, I'm not sure, but this is what I have understood about them. So it is being practiced in South India or in India. These Marmanis, they kept it as a secret because they had a fear that if you know the Marma points, you may injure somebody else. So they won't reveal it to the common people, or they will give only to certain people, or not, sometimes not in the family. Them For them, the Vaidya or the Marmani who has to test the student for so many years, and once if he is confident about this person won't misuse it, then only they will give. So like that, lot of knowledge have been lost because suddenly the Marmani die, and none of the knowledge will be imparted to the next generation. So like that, we lost lot of knowledge, and in China they were more practicing it, and that way it developed more. And the difference I feel, they are saying some sort of their energy system, we call it Vata Pitta Kapha, prana and all. They have their own way of I don't know the exactly yin and yang or something like that.
Yin yang,
the energy
balance,
system.
yin yang, yes,
Yeah. So balancing that. Here we talk about the balancing of the three doshas, that is the organic forces responsible for the health and disease. So somewhat similar in that way, trying to balance the energy system, whether it is, and when we compare it with the Marma therapy and Chinese medicine, but we can say there are so many similarities in that, and there are certain differences also. That is what I understood. And in the practical things, because last year we had a patient here from South Korea. So he was explaining me that he's practicing Chinese medicine, and he told me that these points are very much connected, because he studied both Ayurveda and Chinese medicine, because we never studied, I never studied traditional Chinese medicine. So I don't know much about that, but this is what the information I got from such people about these Marmas and Chinese system.
So Manoj, not just because you spoke about this gentleman from South Korea, I do understand that a lot of people come from different parts of the world to your hospital, which is there in Thodupuzha. Okay.
Yes.
So
yes.
How do these people perceive? One thing, how do these people perceive Ayurveda? One part of it. More specifically, how do they perceive Marma? Okay. How do they do that? Europeans especially, or people from, I think you get a lot of people from Russia, or other parts of Europe also.
Yeah, now we are getting people from not only from European countries, but from even now we have two people came from Japan. Last week we had a person from Japan, and we used to get it from Israel, Cyprus, and meanwhile I felt very sorry about the war happening there. Some of our patients are suffering there. Got a call from them. So like that, the people from different parts of the world, they are realizing the importance of nature healing.
See, holistic approach.
Yeah, we can say the holistic approach. See, no doctors, no surgeons can heal a person, as we know. We can only treat. We can create an environment in which the body itself will heal. Correct. So this is what everyone realizing now. Okay, 30 years, 40 years ago, what people, if you get a pain, you take a tablet and run. They won't give any time for the body to heal. Then it will get worse, and one day you will be in bed. But now the awareness have come up this way, even from the modern doctors, the importance of pathya. We call it as pathya, right? So what is pathya? Most of the people, says that those days pathya is something. If you go to Ayurveda, they will give pathya. But I also don't know what was pathyam those days, in my childhood. But when we studied patyam, patishu hidam patyam. So that which is good for the person in that particular condition favorable for the purpose of healing. So whatever there is nowhere it is mentioned that you should not eat non-vegetarian, you should not take alcohol, you should not. There are certain, when you're taking certain medicines or treatment, some type of food may not be compatible for your body. It cannot be digested by your body, or it can be against the principle of the medicine. Then that particular food cannot be used for that particular time. Correct.
So yeah, usually what happens is, see, even the same thing, when people come to me and tell, you Ayurveda, they say a lot of patya. They don't understand that the patya is for the condition in which they are. Very rarely we have got patya for certain, some medicines we say don't take this because it can counter react. Otherwise, 99% of the time, the patya is for the condition in which he is, irrespective of whether he's taking homeopathy, Ayurveda, or whatever, naturopathy or modern medicine. The patya is for the condition in which he is. That they don't understand. Patya, you say, right? They don't understand that. Okay.
Correct. Yeah. So this is what the education we have to give the patients now. The problem is this type of education is not given in our school or in your curriculum. Why, what pathyam is, and how the body heals, how the body works. We study certain organ system, the basic things what you are seeing in the physical body. But apart from the physical body, we have different levels like the Sukshma Sharira, Karana Sharira. When we look in all this, the people are getting aware of it nowadays. That's why people are coming to Marmmayogi. So in Marmmayogi, we are not only giving the physical medicine, we give sometimes, as we know, Ayurveda got 3 branches, right? The what do you call it? The physical medicine, the mental medicine, and the spiritual medicine, right?
Yes.
I hope you remember that. Yeah. So what do you call it? Adi Bhaudika Chikitsa, Adhyatmika Chikitsa, and Adi Devika. Yeah. So these 3 has to be combined. So recently, I have a very, very special case. One person from Singapore, okay, he's a Indian origin person. I think he's in his 30s, 35, 36. Came to us with a big wounds, diabetic ulcers, okay, under his foot. The doctors there suggested him to go for an amputation of some part of his feet because of the ulcer. It is spreading, and it can be dangerous. Gangrene. Somebody suggested him here, and he came. And actually, I also don't know how to treat it. Okay, so I have never treated such a ulcer like condition. So I was searching with many of our seniors, like in Trivandrum Ayurveda College. There was some of our seniors. I talked to them. I talked to our classmate Dr. Gogul. So I was talking to many Marma therapist people also. Somehow we have, because they came to us with that faith of healing. So I was actually in a very, very much in stress. And one day, when I was talking to him, I said, see, there is a possibility here where you can apply certain medical astrology and the energy level in the spiritual body. And with that, maybe we can try. Because we cannot say that the people think that it is all, supernatural, superstitious things and all. But that man said, whatever you say, I will do. I want this to be healed. That's all. Okay. So I took him to one of the specialists here nearby. And he was checking his, energy level using the Kavadi and all these things. He asked him one question.
Looking at his horoscope?
Looking at the, the Grahanila, all these things, the planetary positions, houses and all this. He asked him one question. How is your relationship with your father? See, normally, we never ask such a question. Okay. So he said, the patient said, very bad. Then the medical astrologer said, he's not only an astrologer, he is a spiritual healer also. Then he said, see, that is something blocking your healing process. Either you have to settle the issues with your father, or you have to move from the family house and to live in a new place. So that helps for healing. So I was in a shock. What is this? But I started thinking about it. Why? See, you can understand this way, or I try to understand it this way. See, if you are in a place where you are stressed all the time, your energies, your hormone systems will be in trouble. Okay, your
Always.
adrenaline will be more, and the sugar level will aggravate. It will never heal if he is in that situation. So you need a place where he is cool and calm. Then the healing happens. So there is some logic I
100%.
understood from it. And of course, he has done some pujas and that sort of things, which is mentioned, in Ayurveda also, graheshu, anuguneshu,
Yes.
they says that. So that is also there. So it is not against our practice.
Principles.
Okay?
No, it is not.
Not against the principle. So he has done all that. And I don't know with what, whether with the treatment or with the puja, or that wound got completely healed in a matter of 6 months to 1 year.
So it's a learning for us also,
Yeah, it is something very, very interesting.
True.
And not only that, there are so many other cases, but this is something very much, visible in the treatment. And so this is something, the people, and because of that particular person, so many of his friends came from Singapore. And not only from Singapore, from Malaysia, his relatives, from other parts of the world. So this is an incidence, in Marmmayogi, we are trying to combine. The only thing is we should know how to understand about such conditions and use the correct method for it. That's what I feel.
So, Manoj, so coming back to, see, this is something which I would like to say, even when I do practices, sometimes we think that we are giving the right kind of medicines, and still if we fail to see some results, I also do that. I ask them openly, do you believe in astrology? Okay, medical astrology. When they say yes, so I refer them, Ponvetan, I refer them. He says small things to them, and combined with our treatment and the medical thing, the astrology thing, it's a smooth sail for him after that, lot of changes we see. I think the thing is that when you look at, Sattva, as you see, the Mani Mangala home and all those things have been told in Ayurveda.
Yes.
At the end of the day, what we should incorporate, whatever gives relief for the patient, right, Manoj?
Correct.
Yeah.
We need the result for the patient. The patient has to be relieved from his issues. So, because they are all connected, you see, the physical, mental, emotional, intellectual. We says about the
Koshas.
Purva Kridam Karma.
Papam Vyadhirupena Jayate.
It will appear. See, there is something, but Papam is actually, it's a tabam. You see, if I have done something wrong, that goes to my subconscious mind and it stays there as a tapam.
Guilt.
Yeah, that heat. We can call it as tapam, the heat. And it slowly but surely reflects in our physical body or in mental body or emotional body. There is no doubt about it. So, and we might have forgot about what happened, right? So it is very deep in our subconscious mind. So these type of enquiries using different methodologies. See, in the physical body, we do scanning, we do X-ray, we do blood test. But that which is gone deeper into the subconscious mind, how can you scan it? So for that, these type of enquiries or searching methodologies may be useful. That's what I feel.
So, Manoj, coming back to Marma, what kind of diseases do you think Marma can actually be applied more into? Okay, mental things, yes, we can, but physically, what kind of things can we apply more, or what kind of cases come to you more?
See, Nambi, we can apply Marma for any healing, any type of disorders in general, we say, because suppose you have say for example an injury or a disease in some particular organ. Okay, it can be due to the we call it as the Nija disorders, due to the wear and tear or due to improper lifestyle or so many reasons. One particular organ is impaired. Okay, so for example, your lungs is not functioning properly, for example. It can be happen due to some allergy, or it can be due to some infection, or smoking, like my father, you remember, because of chronic smoking. So there are certain marmas which is mentioned to activate the functions of lungs. So in my father's case also, after you remember his surgery, I used to stimulate such marmas so that he feels some relief from it. I'm not saying that he recovered from it, but at least to certain time, that when his saturation, oxygen saturation is going down, by stimulating such points that he feels better. That means the saturation level temporarily at least has improved. So like that, for every conditions we can apply marma. Okay, because these are the prana energy centers. The prana has its own consciousness, and this prana will help for the healing. As we know, prana is Narayana, or
Yep.
we say that Vada is Narayana. So the healing happens naturally if the prana flows in a proper way to that area. So the purpose of Marma therapy is to make the flow of prana in a proper way, and also by that the process of healing will happen naturally. So we cannot avoid any, or we cannot say that this is not under the scope of Marma therapy. But still, for your question, I can say that we normally treat, because the number of cases more comes to us with the neuromusculoskeletal problems. So something connected to the nerves or to the bones and joints and ligaments, muscles. So these are the common injuries you see. So these problems can be treated, or what we are getting more are people with this type of diseases.
So injuries can be due to long-term wear and tear, or
Correct.
injury can also be due to some fall or some hit.
Correct.
Okay.
Correct.
Or one other condition is I can go back to the flashback in 1991 or 92 was a time when I came to your place with my injury was, yes, it was, I don't know whether it can call it wear and tear or injury. Yes, it was a sports injury, because I used to be an active sports person when I used to play, and I had this bone calcification at the back of my heel. I don't know, Manoj, you remember that really well, and it was so
And I mean, this
painful
is
for me.
definitely a chronic injury. You see, the Achilles ligament. When you play, you are using a lot of the that particular muscle being used, and continuously it is getting some injuries where it is joining with the calcaneal bone, and first it will develop as an inflammation, then it becomes calcification. So it is something due to the chronic injury only.
Yes, and I remember when I came there, I met Manoj's great grand uncle, which he was telling. He was, by the time he was pretty old, and if I remember right, I don't think he had great eyesight also by then. I think he was,
Yeah, his
yeah,
eyesight was impaired that time. Yes.
but he was, and I remember, so I just spoke to him. I had to go close to him and talk to him, and he was a very frail. I think he used to have only half a liter of milk with little bit of rice every day. That's all his food used to be per day, a little bit
For
here
your
and there.
information, Ambi, he never used to eat rice for many years. I never
Okay.
seen he is eating. He
So he's
used
not,
either used to eat, the what do you call it as buckwheat, right? Suji godamba.
Goduma.
Is
Yeah,
it goduma?
Goduma. Yeah, buckwheat. Yeah, broken pieces. Of,
Yeah,
yeah.
that is what he used to boil with milk and used to eat.
Okay. So probably that is one. So what I'm trying to tell you is, when I went to him, see, he was a frail old person, but when I showed my leg to him, the first grip which he held, when Manoj was close to about 18, 19 by then, and this gentleman was close to about 90 years, if I'm right. The way he held my foot with his thumb, the amount of pressure which he could generate with that one thumb, that old gentleman, I was shocked. I was yelling in pain. So he said, idakashiri om, he said, and he told Manoj, go take this medicine, take this medicine, take this medicine, do whatever. And I stayed with Manoj for about 2 weeks, and after that, I have never felt pain on my left leg. That pain, so I'm telling you,
Yeah,
it's close to about 30-year-old.
I do remember.
Yeah. So it's my personal experience as to what Marma therapy and how, they used to do a massage over there, and the way in which the tendon used to get manipulated, and then Thai medicines, and then, Upanaha, we call that in Sanskrit, Upanaha and then leave the person. It was, for me also, it was a great experience, first-hand experience, I would say, as far as Marma goes. So Marma, one thing, Manoj, is there some points which people see, just for information, okay, people who are at home can do some marma techniques to basically stay healthy. If you keep on, okay, you keep on pressing this, your heart becomes okay. You keep on pressing. We see a lot of things on TV nowadays, on WhatsApp. Is it actually true, or are there some points which can actually activate something like that?
See, for example, Nambi, we do a type of yoga asana that we follow here is called Marma Mukta asanas. Okay, so the Marma Mukta asanas are actually releasing the flow of prana, okay, or blocks in our body. We started from the tip of the toes. See, when we look into it, see, when we stretch and bend the toes, actually what happens? It is in the, it's a, mostly we ignore the legs and also the thumbs. If there is an injury in the thumb, we won't take care of it. But if it is somewhere up in the body, you say, oh, there is an injury, you have to. But at the tip of the toe or in the nails, normally usually people, they ignore it. And, these are the points where we, lot of chance of getting infections through which, because we are walking on the street or infection can easily go in. It can be any type of infections. But when we do what I want to say is, when you do the Marma Mukta asanas, when you stretch and bend the toes, what happens? The circulation will improve. The flow of prana will improve. That's what we say. The lymphatic drainage will improve. The venous drainage will improve. And also stimulates the energy centers in that points. So when you do that, nerves the whole lower limbs are activated actually. Okay. So by that, not only that, when the energy flows or the circulation improves, it activates the function of your heart. So don't think that when you stimulate there, it will not act in our other parts of the body. Even a small injury happens in the tip of the toe, the whole body will be alert, right? We are... so that is how the Marma works, I feel. When you stimulate there, through the central nadi, it goes to your brain. That's why, if you have an injury in that particular point, the person becomes unconscious because of the, maybe due to the shock or due to the flow of prana. It's a mechanism of the body. Yeah. Shipra. Yeah. So if you get an injury, the people say that it creates atsheba, the convulsions, right? So,
convulsions and death also.
Yeah. Yeah, so it is something like that. The injury happens in the tip of your toe or in the middle of the toes. The whole body will be reacted to it and the person may die, it says. So that much of energy is being stimulated. So there are some points in the legs or in the hands or in the ears, on the face, through which by stimulating such points, the function of the heart, the function of internal organs can be cleared or stimulated. See, so, the treatment, if you look into any of the treatments, look at the panchakarma, where generally we do, you irritate a system. You are irritating the nasal passage so that the toxins will go out. You give medicine for Virejanam, it irritates your Pitashya and it happens. When you give Vasti, also the same thing. So when you do stimulation means an irritation. Okay, we can take it that way. So that the areas of the what do you call it, the nadi system connected to that will be functioning or it gets alert.
Yeah. So what happens? Reboot happens.
Yeah, rebooting. Correct.
It's like a phone. We reboot the phone. Reboot. Huh? What is happening? So the ways so apart from using Marma as a therapy, Marma also can be used basically to stay healthy. Is that what you say? By doing it on a regular basis, certain points, keeping on doing it on a daily basis. And one thing I also understand that in your center, you also incorporate yoga, right? To stay healthy.
Correct.
Yeah. So so one thing, let us slowly, probably we can slowly wind up by coming to the last part of this. Is Marma safe for old people and children also, young children and old people, or only healthy people should undergo Marma, weak people and elderly people or young people, pregnant ladies? Do you think anybody has got any exceptions where Marma is not supposed to be done?
what I understood from my grand uncle is you can apply marma to anyone, not only for human beings, but also for the plants and even animals. You can apply marma because
Okay.
by stimulating the energy centers. Say, for example, uh, a plant next to your house. Okay, you go and touch the plant, talk to them, do a massage for the plant. They will be, flowering much better. You might have seen that. So it is a way of
Yes.
imparting the activating the prana. They also have emotions. They also have, what do you call the chemical
Feelings.
system. So we are helping that plants and animals to do it better. Everyone needs. Why we all live ultimately? We are all here to enjoy our uh, original status, what we call it, Sachidananda Swarupa. So we have to feel ourselves. So anyone you can apply, you can touch a person when you do a massage or a stimulation. You should be aware of it, the how much pressure you are applying and what all area you have stimulating. So that's all I feel. See, for old people, I think your mother is now 80 plus, right? So if she gets a
Yes.
pain, you just go and do some massage for her leg and stimulating some of the energy points in the leg. She feels better. So
True.
definitely, Marma can be applied for everyone. You remember your daughter and my daughter, they are, I think, same age. We used to give them massage when they were 2 years
Yes.
or three. Remember that. So, see, that is something which
That's
is
so.
stimulating them also. It's a not only the energies in it, but it is the feeling, the emotions, all will work out in this Marma therapy.
So it was great, Manoj, talking to you. Anyway, our families have been connected for the past 30 years, and it's been great, being with each other through our thicks and thin, and I'm so grateful to Manoj for his contribution to what I am right now. Okay. And I know it's vice versa also because we have interacted on so many levels. And so it's been great, Manoj, talking to you. Anyway, we'll get back soon, okay, with a different topic. Okay.
Sure, sure, Nambi.
And
Thank
take
you
care,
for giving
Manoj.
me the opportunity.
Yeah, it's all, it's our pleasure always. Okay.
Yeah. Okay.
Yeah. Bye, Manoj. Bye. Okay.